Hi, Dr. Yass here. In this video, we are going to discuss Itb tendinitis. The common symptom that this diagnosis is attached to is pain along the side of the thigh. In many cases, it relates to pain at the lateral aspect, the side aspect of the knee joint. Sometimes it could even relate to pain around the kneecap. So I want to start by pointing out that when you go to the medical establishment and you get this diagnosis, they'll say you have Itb tendinitis. And of course, with the phrase itis attached at the end, the promotion is that you have inflammation, and therefore you should be on an anti-inflammatory, or you should get a cortisone shot. Well, the reality is, it is not inflammatory. Tendinitis, as described, is actually irritation of a tendon associated with some sort of force deficit of the muscle that the tendon is attached to, that attaches the muscle to the bone. That's what tendons do. Tendons attach muscles to bones. So if there's some sort of irritation of the tendon, it doesn't mean that there's some structural variation to the tendon and the tendon needs to be addressed. It means that there's a force variation from the muscle that is attached to the tendon, that the tendon is then attaching to the bone. So when we're addressing an Itb tendinitis, we're not looking at the tendon per se, we're looking at the muscle that sits above the iliotibial band. That's what is acting on the Itb. So I thought it would be good if you got a picture so we could really make sense of this. So here is your iliotibial band. Here is the tensor fascia lata. That is the muscle that controls the tension on the iliotibial band. And you can clearly see that it runs down to the knee joint. So if there was a straining of the tensor fascia lata, then you would cause some sort of altered tension on the iliotibial band, which possibly could cause an excessive pulling on its attachment at the knee joint. Here you see it attaching to the fibula head, but it also has a partial attachment to the kneecap. So if you were to have some altered load on this, it's going to cause an altered force on its attachment to the bone, and it actually doesn't attach to bone. It actually attaches to periosteum, connective tissue, that is surrounding the bone. So you're getting an excessive pull on periosteum, and since periosteum is connective tissue has the highest density of pain receptors, that's why you would feel pain at the side of your knee. So if we go back to the concept, it is a straining of the tensor fascia lata muscle causing an altered force on the iliotibial band, which is what controls the tension on the band, leading to excessive pulling at the knee joint, creating pain, possibly along the side of the thigh, but oftentimes at the knee joint. Now, if we look closer, you'll see a much bigger muscle here called the gluteus medius muscle. This is the primary muscle responsible for creating balance and stability when you're standing on that muscle, or even more in terms of if you're jogging per se, and you have both feet off the floor at any one time, you're then going to put your foot down, which is putting 3.5 times your body weight's force on the leg. This is the muscle responsible for absorbing that force. If this muscle is to strain, it will cause an excessive use of the tensor fascia lata and the iliotibial band. So you can't just say somebody has an Itb tendinitis. There has to be a cause. There's always a cause to these things, right? So anyone who's simply treating your Itb band clearly is just wasting your time, because this doesn't just magically happen. It happened for a reason. The reason is because the gluteus medius strained, causing the tensor fascia lata and Itb to have to overwork, and that's what's caused the tensor fasciae latator strain to create an excessive load on the iliotibial band, creating pain at either the band itself or its attachment to the knee joint. Okay? So hopefully this will clarify what Itb tendinitis is. It is not itis or inflammation. If it were inflammation, just like if you had sprained your ankle, had a contusion, you had a reaction, allergic reaction to a bee sting, even a pimple itself represents inflammation. What are the 4 symptoms associated with inflammation? Pain, swelling, heat, and redness. For anybody I've ever treated who had irritation, not inflammation, but irritation of the iliotibial band, there was no heat, swelling, or redness associated with the location of the pain. Therefore, you could not say that inflammation is present. Therefore, don't get conned into being told you need a cortisone shot or an anti-inflammatory, any of this nonsense. These issues in almost all cases are mechanical in nature, muscular in nature. Anything associated, especially if you're going to tell me that you're having this pain associated with walking up a flight of stairs or possibly walking or standing for a long period of time, certainly jogging. Also, if you sit for a long period of time with your knee bent to 90 degrees and then try to stand up and get the pain along the side of the leg. What you want to understand if you look at this picture is that this is actually, it's not the greatest picture, but it's actually going to show you that this is actually an attachment to the backside of the kneecap. So the iliotibial band falls in line with the hamstring, the posterior thigh muscle, as a knee flexor. It actually bends the knee. So if you were having a strained muscle and then you bend it excessively, as in sitting with your knee at a 90-degree angle, this is going to allow this muscle that's running along the thigh here to shorten excessively. So when you go to stand up and you suddenly need it to fully lengthen, it's not going to be happy about that. And it's going to elicit pain at its attachment at the knee joint, or even possibly along the ITB itself, the side of the thigh. So one other possible cause, so I've talked about the primary cause of Itb tendinitis being this gluteus medius muscle. Well, let's talk about this other concept. In the front of the thigh is the quadricep muscle. If that were to strain, remember the quadricep extends the knee, straightens the knee. Well, if you lost force in the ability to straighten the knee, then any muscle that bends the knee will have a tendency to shorten excessively. And when you want to suddenly straighten it, it will run into a problem and elicit pain. So the 2 primary reasons that you might get Itb tendinitis is a strained glute med or a strained quadriceps muscle. And the only way to really know which it is through a proper physical evaluation, which is at the core of the diagnostic model of the Yass method. There is no dependence on x-rays or MRIs. That's all crap. It's never worked. All it finds is structural variations that existed well before, especially when we're talking about something that, I would hope most people would recognize as relating to muscle. Muscular deficits don't show up on diagnostic tests, and there is sure as hell no medical specialty educated or trained to identify these types of causes. You need someone who understands muscular causes, who understands mechanics, functionality, the relationship of muscle to function, variations in movement patterns and posture that will help to identify which muscles are associated with the cause of the tissue that is irritated, eliciting the pain. So you basically need a Yass evaluation if you want to know what is causing the irritation of your ITB, and therefore the proper way to resolve it. So, if you have a question, if this has struck a nerve in you, not really a nerve, but actually just your interest, then you can contact me by email at drmitch@mitchellyass.com, drmitch at mitchellyass.com, and I will help you to clarify what might be creating your symptoms. If, in fact, this has really sparked an interest and you'd like to set up a Skype or Zoom session regarding this issue, then you could also contact me by email at drmitch@mitchellyass.com, drmitch at mitchellyass.com. If you like this video and it makes sense to you, give it a thumbs up. If you like my YouTube channel, Dr. Mitchell Yass, and would like to get notifications when new videos are being added or when I'm live on YouTube, please subscribe. Please subscribe. Please subscribe. It helps you to find out when new videos are being added. And I hope that people see these, and I do believe the comments left always indicate that these are really positive videos that are helping people understand what are creating their symptoms and helping to guide them to the right types of treatments necessary to resolve their symptoms. That's what this is all about. In more than 98% of cases, the cause of your pain is muscular. You're not going to hear that from anybody else, but I'm telling you, that is fact. The empirical presentation, what actually is, will tell you that's the fact. So you need to have a muscular resolution, and that's not going to come from a medical-based type of treatment protocol. It's going to be a fitness-based, and I don't mean a personal trainer. I'm talking about the Yass method, which is completely outside the medical and fitness industries. So please think about it, and it's here, it's available. Take advantage of it. So for now, this is Dr. Mitchell Yass wishing you a pain-free, fully functional life. Bye-bye for now.